Hi, Dr.Susheela Suresh here. I'm a consultant in internal medicine from the Vydehi Super Speciality Hospital. It's located on Vittal Malya Road. Dengue or dengue fever is a viral infection. It spreads with the dengue virus, which is transmitted by the mosquito. It's also called the breakbone fever. Now, dengue virus spreads with only mosquito bite, which is caused by a mosquito called the Anopheles mosquito. The speciality of this mosquito is that it bites only during daytime. Dengue fever is related both to rain and mosquitoes. When it rains, water is stranded in the pots on the roadside and various stagnant areas, and typically Anopheles mosquito, which spreads dengue, breeds in these areas, and within 5 to 7 days you will have hundreds of mosquitoes spreading the virus all over. Typically, since it is called a breakbone fever, it starts with very high fever, eyeball pain, pain behind the eyeball and over the head, and severe pain over the back and in the legs. This is the earliest symptom, which lasts for 2-3 days. Subsequently, you might get a rash which is red and pinpoint, and you might also have other complications. Dengue fever has 3 varieties: the simple dengue fever, the dengue hemorrhagic fever, and the dengue shock syndrome. In a simple dengue fever, you just get fever, body pain, you're tired, and you're okay in 4 to 5 days. But dengue hemorrhagic fever is a more serious version of the same. After about 3-4 days of fever, you could get low BP and you could faint. You could get a rash and red spots which indicate drop of one fraction of the blood called the platelets. Now, platelets are usually required to keep the blood clotted, and when the platelet count, which is normally 1.5 lakhs, goes down to 40, 50, 20 or sometimes below 10, you could bleed to death. Now, the third type of dengue fever is the dengue shock syndrome, where your blood pressure is so low that you can hardly stand, you tend to faint, you're very tired, and unless hospitalized, it might be fatal. Yes, earlier when dengue just came into Bangalore, there were many patients who were dying of dengue. Now that we know the disease and we diagnose it quite early, the chances of death are very low. But if you don't take precautions on time, 1 in 100 to 1 in 1000 may get hospitalized, and if you come late, you could die. And the causes for death would be bleeding, either internal or in the brain, or a shock-like syndrome where all the organs will fail, including kidney, liver, brain, and you end up on ventilator and it could be fatal. The blood test that you should do when you get very high fever and a lot of body pain and eye pain is called the dengue profile or the dengue NS1. Very early in a fever, if you don't have cough, cold, vomiting, loose motions, or any urinary symptoms and just fever, in this season at least, it is dengue fever. So please do the dengue profile in the first 3 days so that you can take the next step. Now, once you know it's dengue fever, you can do the complete blood count and look for the platelets. Now, the normal platelets are 1.5 to 4.5 lakhs. And if it is down, then it is mandatory that you check your platelets every day. And if you're very sick, get yourself hospitalized. Now, the other tests that we do if the dengue is more severe and patient is very sick is liver functions, kidney function test, a chest x-ray, and sometimes even an ultrasound to see whether there's a collection in the lung or in the abdomen. If a patient of dengue fever has low blood pressure, cold and clammy, BP is hardly recordable, lot of red spots all over the body, and typically if you're bleeding from the gums or in the urine or in the motion, it is absolutely serious. Most part of dengue treatment is supportive. You get hospitalized, you take antipyretics for the fever, you take medication for body ache, you hydrate yourself well orally as well as take drips sufficient so that you will have enough urine output and you are well hydrated. Other than this, some pantoprazole for preventing vomiting and some vitamins and sometimes these papaya extracts to keep the platelet going. Now, in case the platelet counts go below 20,000, then you need to take a platelet transfusion. Now, it is called single donor platelet. It is to be got from the blood bank from a donor So preferably a donor of the same blood group. It's very important to take precautions for dengue fever, especially during rainy season. You need to probably wear full clothes. Make sure that you have a mosquito repellent going around in the house. And if you're outdoors, you could use mosquito repellent creams on your body. And most important precaution is don't allow water to stand around the house in the pots or in the garden area or in front of your house on the footpath sides. It's also important that you take precautions early enough to go to the doctor when you get a high fever without any reason.